So we all know what fun is without an H. But fun with an H is a collaborative venture of 10 community health centers operating in the Twin Cities metro urban core. And annually, 110,000 people come to our clinics who are very sick, poor, and diverse. But in this competitive healthcare world, we saw an innovative opportunity for the clinics to collaborate on the state's integrated health partnerships and do the triple aim. However, for us as safety net clinics, we saw this as an extreme sport. It took courage for us, breaking the status quo, risk, learning a lot, and sustaining a belief that we can do better together. When Fun joined the IHP in 2012, we had no clue what we were doing. It was clearly a leap of faith. What is TCOC? Risk adjustment? Motivational interviewing? What's all that about? We needed help fast. We contracted with Optum to show us the way. And yes, Optum of United Health Group, the largest healthcare organization in the world, working with us little clinics in the Twin Cities metro. But as passionate advocates for the underserved, we said, oh, we can do this, of course. We needed to change, however, from our old ways of doing things to our new ways of doing things. We had to move from fierce competitors to extreme collaborators. At first, we wanted to act independently. But we came to realize very quickly that my clinic's success was dependent on your clinic's success. So we began to share best practices for clinic transformation. We shared resources and money. 10 medical directors got together and agreed on standard protocols. And together, our care coordinators started new ways of doing things. But really, the tipping point came when there was complete transparency among all the clinics on their financial and clinical data. We saw this as a wonderful opportunity for learning among each other. A number of clinics, though, decided to freak out at this point. And some said, oh, no, we're going back to the old ways. We're not going to do this new stuff. But we fortunately got back engaged. But with complete honesty, we had some pretty sticky situations that we got into along the way. Some conversations with our DHS friends got a little contentious, and we started to have some culture cracks with Optum because of two different incentives. But when we all really started humming, we had many groups of staff meeting together, 10 CEOs, 10 CFOs, 10 HIOs, 10 medical directors, and many care coordinators. But we found that data analytics, as many have mentioned, is an extreme process for us. We had to learn about resource utilization bands, care management. We're just community clinics. Why would we have to learn all that stuff? But then actuarial analysis was even more extreme, for some of you who know this. We had to learn relative risk factors, IBNR claims adjustment, claims cap adjusted PMPM. We had to remind ourselves we had to do what we didn't think we could do. So it took time to put all this together. We began to speak the language. Clinical transformation started taking place in the clinics, and we became successful. So back to the triple aim. This is the savings that these little fun clinics in the metro area urban core gave to the Minnesota taxpayer over the first 3 years. We did this through ER reduction, opioid misuse management, and diabetic management. We developed a really fancy identification and stratification tool to identify gaps in care and what would bring down the total cost of care. Without a hospital or specialist partners, we had to focus on primary care. Our patients are happier and healthier. They have better access to care. They have less trips to the ER. And we gave them good advice and treatments. They also are happier. 90% said they would refer family and friends to our clinics. And they were able to get appointments much sooner than they could before. And isn't this what it's all about? So thank you for joining me on this little fun flight today. And that's with an H, of course. And really, that's what collaboration really looks like. Thank you.